name is Ncoza Dlova. I'm the head of Dermatology Department as well as a full professor at the Nelson Mandela School of Medicine, University of KwaZulu-Natal, Durban, South Africa. We try and ensure that our work is underpinned by research, and I'm glad you asked this question because one of the profound work that we think we did from the institution was to look at the genetics of central centrifugal cicatricial alopecia. Central because it occurs on the crown, centrifugal because it spreads that way, and cicatricial because it causes scarring, which is permanent hair loss. And alopecia is hair loss. Alopecia means to any form of hair loss. It's not diagnostic. So for a long time, it's been thought that CCCA, the condition that I've just described, is due to the use of hot comb or chemical products by Black women. And in fact, it is one of the most common scarring, that is permanent hair loss conditions that we see amongst women of African ancestry. So we were quite thrilled to discover that 25% of the patients who have CCCA actually have, we identified the PAD gene 3, which was isolated in these patients. And we worked together with colleagues from the USA, North Carolina, Professor Amy Michael, as well as Professor Elis Precker from Israel University, to try and see why is it that we're seeing this condition in certain families when in actual fact it was labeled as being caused by hot combs or chemical products. So during an observation of the patients that we see in the clinic, we found that there were patients who actually had virgin Afro-textured hair and they'd not used anything. However, the family members, I do remember this patient actually. It was a young lady who had scarring alopecia involving the crown. And she told me that her mother also has hair loss, and her mother was in her 80s. And the patients in the 80s, they were just wearing a doek and they were not doing anything on their hair. And then I requested her to kindly invite her daughter, who was about 11 years old, to come and see us. And when I examined the daughter, I found a patch of alopecia on the crown. I was quite excited to see this because I'm like, wow, how do you explain this now? There's no history of this. It's natural. It's a young girl. How could it be? Then I started looking at patients and started calling the family members to try and see if we're seeing this trend. And lo and behold, we actually saw the trend that there were family members who had patchy areas of hair loss without having used any of these chemicals or heat. So that's when we started doing biopsies, calling the patients, and then collaborating with the geneticist colleague and friend, Dr. Elis Precker and Dr. Offa from Israel. And that's how we discovered that CCCA actually, a portion of patients, it's attributed to a genetic PAD3 gene. And what we also found was that, interestingly, those patients who had CCCA and practiced frequent manipulation of their hair, that is, relaxing the hair, braiding the hair, pulling the hair, the progression of the disease, CCCA, was much faster. So the extent of the disease was wider and the progression was faster. However, those siblings who kept their hair natural and did not use any chemical products or heat, the progression of the disease was much, much milder. So what it meant to us is that, okay, we probably have the gene, the defect, and one has the condition. However, there could be mitigating factors, and that if we avoid 1, 2, and 3, that is the things that I've mentioned, we can actually halt the disease and control the progression of the disease. As to where we are now in terms of how far has that gone, not much really, because it would have been nice to be able to do bedside tests and say, okay, this is a test that we'll do to actually check whether one has got the condition or not. However, we're not there yet, but we haven't stopped searching and going on with the research. What message do we have for patients and consumers? I think it's important if you realize that you have the condition, or let me say you've got alopecia, which is hair loss, which has lots of causes. It's important that you see a dermatologist, and so you can get proper assessment as to what is the cause of the alopecia, what is the diagnosis, and how, what interventions will be taken. Because the other thing about alopecia, the hair follicle is a rapidly growing organ. So it's important that diagnosis is made quick and fast. Because if it's delayed, then you get permanent hair loss. The root is gone and there's not much you can do. So we always refer to it as a trichological emergency. Trichology means hair emergency, yeah. So if there's a family member who has hair loss, it's advisable that you consult with your dermatologist or your doctor or GP, who can then refer you to a dermatologist. If the dermatologist is not sure, they can always refer you to a dermatologist who is a hair specialist or has an interest in hair.